Welcome to Hospice Overview with HonorView Hospice. Today we will be discussing Hospice 101, which is an understanding of the hospice philosophy, different levels of care, and a general understanding of the basics of hospice. Introduction to hospice care. Hospice care is defined as a comprehensive interdisciplinary approach to caring for individuals with terminal illnesses. The goal of hospice is to provide high-quality, patient-centered care that addresses physical, emotional, social, and spiritual needs. The goal is generally comfort-focused rather than restorative-focused care. People often get confused between hospice care and palliative care. To simplify, hospice care is for patients with terminal illnesses. Terminal illnesses are generally defined as illnesses in which the patient has 6 months or less to live if the disease takes its current diagnosed course. Palliative care is for patients with serious illnesses that may not have a limitation on the time left for the patient to live. The hospice philosophy includes the following: a focus on comfort, dignity, and quality of life, providing patient-centered care, an interdisciplinary team approach, and a holistic approach to care. This means that multiple team members will be involved in care, from a physician, a nurse, a social worker, a spiritual care provider, and an aide at home to provide personal care, as well as a holistic approach to care, which means that taking care of the patient, not just in their physical needs, but also their spiritual, personal, and other needs as well. Hospice services can include, but are not limited to, medical care and symptom management, pain management, emotional and spiritual support, social services and support, bereavement support for family and friends left behind after the patient passes, volunteer services, and dietary counseling. Multiple other services can be made available to the patients based on their current care and service needs. For a patient to be eligible for hospice services, they must obtain a physician's referral in the form of a physician's order. They must require pain and symptom management from the hospice team. They must desire palliative or comfort care services instead of life restorative treatment. They must have a primary care designee and have a terminal illness with a limited life expectancy of 6 months or less if the disease runs its expected course. Hospice care is distinct in its interdisciplinary care team, bringing together a diverse team of professionals, including physicians, nurses, social workers, and spiritual care coordinators, home health aides, and volunteers to provide a comprehensive patient-centered support group. This collaborative model allows us to address the physical, emotional, social, and spiritual needs of our patients and families, tailoring our care to their unique experiences and priorities. The physicians provide medical direction and oversight to the team. The nurses coordinate care and symptom management. Social workers can provide emotional and social support. Spiritual care coordinators can provide spiritual support and counseling, as well as life review and other needs. Volunteers can provide companionship and engagement, and the home health aides provide direct personal assistance with care and companionship. Hospice care encompasses various levels of support. Each level is designed to meet the unique needs of our patients and families, providing flexibility and adaptability as their journeys unfold. Routine home care is provided in the patient's home, wherever they call home, with visits from the hospice staff as needed. Continuous home care, or crisis care, is intensive care provided in the patient's home for a short period, generally 24 to 72 hours. Respite care is temporary care provided in an inpatient setting, generally a skilled nursing or assisted living facility, to give family members or caregivers a break from patient care. General inpatient care, or GIP, is provided in an inpatient setting, typically a skilled nursing setting or a hospital setting for patients who require intensive symptom management. From the comfort of their own homes to inpatient facilities, our interdisciplinary team is committed to delivering care that is not only comprehensive but honors the individuality and dignity of every patient and family we serve. Continuous home care or crisis care is the level of hospice care that provides an intensive, around the clock support to patients and families in the comfort of their own home. To be eligible for continuous home care, also called crisis care, the patient must require intensive care to manage pain or other symptoms. The need must be short-term, typically 24 to 72 hours, and they also must have an inability to care for this need themselves with their caregivers due to the condition. The caregiver must be able to provide support and assistance and have support from the hospice team. The medical necessity can be anything from pain to shortness of breath to safety conditions. The short-term need is typically 24 to 72 hours. Medicare defines continuous home care, or CC, as 8 hours of aggregate nursing care over the 24-hour period. Continuous home care does not mean that hospice will be in the home the full 24 hours. It simply means that 8 hours of that care will be provided by skilled nurses provided by the hospice. Skilled nursing can be supported by other disciplines such as social workers, chaplains, or home health aides. The patient cannot be able to care for this need themselves. Typically, the patient is unable to care for themselves due to this crisis. So the patient's pain, anxiety, agitation, safety, or any other need must be preventing the patient from being able to care for themselves. This could also be an exacerbation of their terminal illness. The caregiver must be available on site to support the patient and the hospice team in providing care for this patient. The hospice team must have availability to be able to provide support in the crisis or continuous care. The patient's home environment must be safe and suitable for the continuous care. If the patient's home is not safe for this continuous care, the patient may have to be considered for GIP or respite care to manage the crisis. Respite care is typically provided as a temporary relief to caregivers, giving them a much-needed break from the emotional and physical demands of caring for a loved one in their home. During hospice care, respite care can be provided in a variety of settings, including private homes, nursing homes, and inpatient facilities. To be eligible for respite care, the patient may require temporary relief from their usual caregiver. The caregiver may be experiencing physical, emotional, or spiritual exhaustion. The patient's condition may require constant care, such as in the case of a crisis. The patient may require a short-term stay, typically 5 days, in an inpatient setting. Medicare typically defines respite care as 5 days per benefit period per patient. The patient or caregiver may apply for an additional couple of days, typically 5 to 7 days, in an inpatient setting. Respite care is typically provided in a skilled nursing or assisted living facility. General inpatient care, or GIP, is a level of hospice care that provides 24/7 support to patients who require intensive system management and care that cannot be provided in a home setting. GIP is typically provided in a hospital or skilled nursing. To be eligible for GIP care, the patient must indicate a medical necessity, an inability to manage symptoms at home, and the facility must have a 24-hour nurse on premises. General inpatient care is usually provided for a short period, between 24 hours to 14 days. Patients may be admitted on GIP in a hospital setting where the hospital can no longer manage the patient's comfort and the patient wishes to no longer have restorative hospital-based treatment. If a patient is admitted from the hospital on GIP care, the patient will not be able to tolerate transportation from the hospital to home, or their care is not able to be managed at home. Typically, the hospice nurse will visit the patient in the hospice every day until the patient expires. If a patient is receiving routine home care in a skilled nursing facility, the patient may be placed on GIP for short periods in response to a crisis or a change in care condition. The skilled nurse will then visit the patient in the skilled nursing facility each day until the crisis has passed. GIP is a very special level of care and requires the skilled nurse managing the patient to provide extra documentation and extra support to the patient and family. Providing hospice care to patients and families is a profound honor. The intention of hospice care is to honor and support individuals facing life-limiting illness, focusing on comfort, dignity, and quality of life. We at HonorView Hospice strive to ease physical symptoms and pain, address emotional and spiritual needs, support loved ones and caregivers, and honor patient autonomy and choices. We aim to foster a sense of community and connection. At its core, hospice care is about living life to the fullest, even in the face of serious life-limiting illness. It's about embracing the present moment and finding meaning, purpose, and joy every single day. By providing comprehensive and compassionate care, we aim to honor the unique experiences and wishes of our patients and their loved ones. At HonorView Hospice, our core values are baked into our culture. We honor life. We celebrate the life that has been lived, and we are devoted to the life that remains. We honor death. We acknowledge the natural process of death and dying, and we strive to elevate the experience by prioritizing physical, spiritual, and emotional comfort and support. We honor grief. We recognize the uniqueness of each person's grief journey and offer support, guidance, and resources. We honor collective wisdom. We value diverse perspectives, experiences, and expertise of our team members, patients, and families, and we foster a culture of collaboration, learning, and growth. We honor relationships. We cultivate community by building meaningful relationships with our patients, families, and partners, and welcome opportunities to create lasting memories. We honor beliefs. We respect and align with the personal values and beliefs of our patients and their families. We honor compassion. We embody empathy, kindness, and understanding. And we honor excellence. We strive to exceed expectations in all aspects of our work. We are so grateful that you have chosen this compassionate and rewarding line of work. Your decision to join our team reflects your commitment to providing comfort, support, and dignity to individuals and families during a vulnerable time. Your work will make a profound difference in the lives of others, and we are honored to have you by our side. Thank you for dedicating your skills, heart, and compassion to this profession. We look forward to supporting you on your journey.